Hi, I'm Shrikant Iyengar. I'm Director of Education for ProHealth Academy in India. I'm based in New Delhi. I think we're in a very unique position now. I think looking at the whole India as such, we are globally upwards trending economy, and I think that basically helps in terms of affordability of people have gone higher. So what now is happening is either before we physiotherapy treatments were kind of little beyond a normal person's affordability limits, as well as we also had an equation where maybe our physiotherapy sciences were not very well advanced. So now what has happened is, I think over the years with people's capacity has improved to pay better, as well as the physios. A lot of physios have gone outside and have trained themselves or upgraded themselves in the most international best practice standards. Also, there are a lot of expats who see India as their provisional place where they can come and grow business in India. So I think we as a nation are becoming more and more aware of our health. I think we're becoming more active now. Sports is slowly trying to get into the society as a normal in the normal walks of life. So I think I clearly see that physiotherapy as such is kind of showing improved standards in terms of looking into global standards, I would say. We obviously go by a lot of research has been backed upon. Physiotherapy over the years have turned out to be a scientifically based science which is proven in terms of lots of evidence to back the kind of work we do. Based upon the kind of problems a patient is having, I think we work a lot upon very protocol and guidelines based, which is purely backed upon by our research. So in case of an anti-cruciate ligament injury, if an athlete or a person individually undergoes a reconstruction of that, so that requires a consolidated 6 to 9 months of rehab program where a step-by-step protocols and procedures have to be followed. So there are guidelines specifically required for a specific kind of a problem, and yes, we kind of try to we obviously the objective is to still look at the whole person as an objective, but we try to keep our sciences very much intact, that okay, depending on we go hand in hand to help the patient get back to the normal life as early as possible. I think again, as I said before, I think it's a unique position right now. I think the whole world of medical sciences is growing. I think the fundings across the nations, across the world is improved a lot in terms of lives, and we see the overall demands of life is increased a lot. I think there's lots and lots of situations where people are having problems because of the lifestyle behaviors and the habits what we are carrying. So physiotherapy somewhere entails down to that similar pattern of medical sciences advancements. I would imagine that a lot of things goes in hand. Before we would see a lot of physical part of as a part of physical physiotherapy. We would think that okay, one structure is injured or it has got a pain and we need to manage that pain, or we need to get the healing factor of that thing sooner. But now we have understood that there's a whole range of situations, multifactorial situations which could result in having a physical problem to someone. That would come down to understanding of psychology of a person, understanding the kind of culture he comes from, the kind of food habits he's got, the kind of level of stresses he's carrying because of his job. So I think one side we have improved in terms of our scientific research to get to upskill our knowledge of skills and to upgrade ourselves scientifically in terms of providing the best physical treatment, but hand in hand we are also trying to acknowledge and recognize those situations which could be potentially causing the problems. As I said, that could include nutrition and psychology and general stress level. So I would imagine that now I see a role of physiotherapist as educator in the society, where end up discussing a lot about the problems to the patient and giving a lot of ownership to them so that we can actually help them to help themselves. So in ProHealth Asia, India, we are very much keen on understanding that then it's going to be a classification based individualized trialized program which we are going to cater to every single patient. We have a strong understanding that no one human body is similar to another. I think one size fits all philosophy which never works in terms of managing a physiotherapy treatment. So what we are keen on doing is, one is to upskill our physiotherapists with the recent advancements, getting the experts from outside and training them to the best possible educations and giving them the skills what is required. But having said that, having a clear understandings of the goals and ambitions of a person who's going to walk in. For someone it could only be a pain modification, for someone it could be running a marathon. So the biggest thing what I would take from our institute or our organization will be to constantly stress and to endeavor to get the best possible tailor-made program for the person, which is very much individualized to his or her needs and benefits. As I said before, I think one of the important part is to continue. I think there's always something new coming up in the thing. I think past 5 years, I think we have seen some of the most startling advancements in terms of research what is coming out. Hamstring injuries to tendinopathies to understanding of how we manage osteoarthritis to low back pain. Few years back, if a problem with someone having a problem with low back pain, having some radiation pain down, the immediate choice would be to go put him in the operation theater, get him a surgery done, and then probably secure him. Everybody wanted to be safe and fine, and then make sure that there's no harm to the back. But now, as we are evolving, we are trying to see that there's a lot of evidence to prove that the MRIs are not correlating to the clinical situation of a patient. I think so that understanding has helped us to ensure that we need to continuously upgrade ourselves to understand and recognize that there could be situations that that all we, as a person who's in front of you, or the clinical presentation of a patient is more important, and keeping that in our mind, we have to have a tailored program catering to that person. So I think the part of the coaching academy or the training academy would be to basically clearly get some of the best experts or the gurus of certain areas, of various skills of physiotherapy, and to get them to India and to upskill or upgrade our physios, and probably open up gates slowly for the physios from the society and community outside, so that we keep becoming a bigger society who understands physiotherapy better. Look, all of these three things goes hand in hand, I would imagine. I think obviously there is the role of a surgeon. If somebody's ruptured anterior cruciate ligament, if he under needs to go a reconstruction, obviously the choice would be to go to an orthopedic surgeon. Sports medicine doctors are in sync between the orthopedic surgeon and physiotherapist. But I think because of the manual skills, because of the ability to go in through that step-by-step procedure every single day till the person is back to his normal life, I think physiotherapists are better equipped in tackling those problems. I think orthopedic surgeons and sports medicine doctors come in play. They have their role in terms of helping us diagnose things better. But I would imagine for somebody who has got problems and ailments, I think because of the kind of understanding of human motion, the biomechanics, exercise sciences, a bit of strength and conditioning, I think physiotherapists are better equipped in helping the patient to actually see him through stage by stage, step by step rehabilitation into a normal life. I would imagine that the overall understanding of physiotherapy is still not there in our society. I think we're kind of lacking where a physiotherapist can fit in and help a person to get back to a normal life. It's still either understood as a very electrotherapy or a machine-based science, or at certain point it's almost considered something like someone who I would go and see if I have a pain, and I would be getting them some rub down or a massage or something, and I get better. I think there's also the point is the way physiotherapy revolves around in India. I think we still do not have a council of our own, and sometimes that's how the challenge is to basically get the quality of physiotherapy generally across to get into our international standard is one thing which I think we're still facing it. And the second thing is obviously, as I said, the awareness of general population. I think if anyone feels that it's only when I have a problem, I go to see a physiotherapist. Whereas we keep harping upon the point that actually if you see a physiotherapist on a daily basis, it will actually help you to live your life better and actually prevent any aggravating or a worsening situation which can actually impede in your normal life. I think aging is a normal part of any human response. I think everybody who's born in this, has got a human life will ultimately go on to age. I think as we're going to grow, depending upon the occupation we have been involved, if you're a trained athlete or you've got a sitting job, it's like occupational hazard will be a part and parcel of everyone's life. Now, based upon that, over a period of time, your body starts to show those responses. You get those general aches and pains. Having a pain for a day or two is fine, but if someone is living with a pain for 3 months or something, that's alarming for me. So my idea is basically even having a periodic, once you realize that you have a certain area of the body which is not 100% fine, getting a periodic checkup once in 3 months is a good idea. Coming and meeting a physio, just discussing about what I've been doing before, how it has helped me to get better or how it has not helped me, if there's some other modifications we can do into the program, and also in terms of advancements and what can I do it to make it better. So I think that is where my idea would be to, and also trying to see that okay, if I could have a knee pain, and to prevent that I'm trying to put weight on my other knee, so that in fact might start to hurt. So all of that factors could be very much interlinked. I would imagine that okay, if we are a little bit more proactive and we see a physio in a preventive stage, I think that is the best way to go about it.